Welcome to Navigating IBD with Stephanie A. Wynn, where she tackles the real challenges of living with Crohn's disease and ulcerative colitis. Whether you're newly diagnosed, supporting someone with IBD, or looking for better ways to manage your care, this is your space for honest conversation, practical guidance, and community. This podcast exists to change the narrative, one story, one strategy, and one breakthrough at a time. So join Stephanie as she navigates IBD together with you. Y'all ready? Let's get started.
Welcome back to the Navigating IBD with Stephanie Wynn podcast, where we talk about the real challenges of living with Crohn's disease and ulcerative colitis, which are two forms of inflammatory bowel disease, and the strategies that actually work. Whether you're newly diagnosed, supporting someone with IBD, or looking for better ways to manage your care, this space for honest conversation, practical guidance, and community is for you. I'm Stephanie Wynn, your host, and I was diagnosed with Crohn's disease in 2017. So I know firsthand what it's like to feel lost in the healthcare system, dismissed by providers, and overwhelmed by conflicting advice. Today's episode is for my healthcare providers, administrators, and anyone committed to health equity. What we're talking about today is what I wish more doctors knew about treating IBD in underserved communities. And if you're a provider who wants to build trust, improve health outcomes, and truly serve the patients who need you most, this conversation is for you. So hear me out. When good intentions aren't enough, this is what happens. You see, I've worked with incredible providers over the years who are compassionate, who have the skills, who are deeply committed to their patients. But even the best intentions can fall short when systemic barriers and cultural gaps aren't addressed. And here's what that looked like. For example, a patient may nod during their appointment and say they understand the treatment plan, but they leave the appointment confused. They don't take the medication correctly, they miss follow-up appointments, and they end up in the emergency room. From the provider's perspective, it looks like non-compliance. From the patient's perspective, really feels like being set up for failure. You see, the gap isn't about effort, it's about understanding the barriers that your patients face that you may not see. See, here's the barrier you may not see. Let me walk you through that. Many of your patients in underserved communities are navigating often invisibly, like blind, because maybe cost is an issue. And maybe the cost isn't just about medication. You see, yes, biologics are expensive. Biologics, for those that don't know, who are not in the medical world, that is a type of therapy for patients with inflammatory bowel disease or some type of autoimmune disease. So they'll prescribe biologics. But so is taking time off for work for the appointments. You see, finding childcare, that's another barrier, right? Paying for parking, covering copays for labs and imaging, or missing a day's work because there's no evening appointments available or time slots available, or even telehealth appointments, right? That isn't an option for the patient. So when a patient doesn't show up for a follow-up appointment, it's not always about prioritizing their health. It's about choosing between paying their rent and a specialist visit. You see the difference? Let's talk about language barriers. That goes beyond language, like the translation services, right? Even when interpreters are available, medical jargon is still medical jargon. So, for example, when you say remission or biologics, disease activity, these terms mean nothing to someone hearing them for the first time. And if your patient comes from a culture where questioning a doctor feels disrespectful, they may nod along without truly understanding. I know, because I'm that patient. You see, cultural mistrust is a real real and it's earned at the same time. So for many Black and brown patients, medical mistrust isn't paranoia. It's actually history. And I don't like to keep living in the past, but we gotta have this discussion that most don't like to talk about when we talk about the Tuskegee experiment, right? It's being dismissed when reporting pain. It's watching family members receive substandard care. And then there's white coat syndrome. Let's talk about that. Not just the blood pressure spike, but the fear and intimidation some patients may feel in medical settings. So for patients who've been dismissed or disrespected by providers before, that white coat represents authority they don't trust. They may not even ask the questions, not because they don't have them, but because the power dynamic makes it feel unsafe. You see, when a patient hesitates to start a new medication or question your recommendations, they're not being difficult. They're protecting themselves based on lived experience. So, for example, food isn't just nutrition. When you talk about, hey, I want you to change up your food, it's about cultural access, right? When you recommend a low residue diet, are you considering what foods are actually available in their neighborhood? What they can afford? What holds cultural significance in their family? So telling someone to eat more lean protein or fresh vegetable doesn't help if the closest grocery store is miles away or if their food budget is $50 a week. These barriers compound everything in a person's life to navigate any chronic illness. And when care plans don't account for them, patients fail, not because they don't care, but because the system wasn't designed for them. But what you may be asking, what does trust actually look like? Trust isn't built in one appointment. It's built through consistency, transparency, communication, and showing patients that you see them, not just their diagnosis. Here's what that means in practice. Number 1, acknowledge the barriers openly. Don't pretend they don't exist. Ask directly, what makes it hard for you to take this medication every day? Or what concerns do you have about this treatment? When patients know you understand their reality, they're more likely to be honest with you, right? And one thing you want to do is check for understanding without condescension. This is a thing. And I'm not saying this just to, this is the elephant in the room. Sometimes provider can be condescending without even realizing it, right? So instead of, do you understand? Try, I want to make sure I explain this clearly. Can you walk me through what you'll do when you get home? This shows you're investing in their success, not testing their intelligence. Sometimes providers can't underestimate a patient's intelligence, and it doesn't come across as compassionate, if you will, or friendly, if you will. It really does come across as condescending. And then the next one is involve the support system. You gotta ask if there's someone that the patient would like to include in the conversation. Maybe a family member, maybe a friend, maybe a caregiver. Many patients manage their health as a team, not solo. I know for me, when I was diagnosed with Crohn's disease, my parents knew nothing about this condition. In fact, my dad was so worried. I could see the fear in his eyes as I lost all of that weight and I was so ill, I couldn't walk. I stopped eating. I was bedridden for quite some time. But when the support system understands the care plan, adherence improves. Sometimes validation is needed when we're journaling a condition that's chronic, as IBD. So when a patient says they're in pain, believe them. When they express concerns about side effects, take it seriously. When they share that cost is a barrier, don't dismiss it as that's just the way it is. Validation doesn't mean you have all the answers. It means you recognize their struggle as real. right? And so let's talk about how I know, because listen, that last point, I was there as the patient, taking biologics and I had to pay a lot of money out of pocket, upwards of $1,000 every 7 weeks. And nobody told me about the patient assistance program until one day a nurse pulled me outside to tell me to ask the doctor about this program, because I was the only patient in that practice paying that kind of money out of pocket for my infusions. So you see where I'm going with this? Now, remember, cultural competence is a skill, not a checkbox. Cultural competence isn't about knowing every cultural practice or speaking every language. It's about recognizing that your patients bring lived experiences you may not share and being willing to learn from them. It's about asking questions instead of making assumptions. It's about recognizing when your care plan doesn't fit their reality and adjusting to it. In addition to this, it's also about understanding that compliance isn't just about motivation. It's about access, trust, resources, and whether the plan was realistic to begin with. And it's about the acknowledging that health equity work requires more than good intentions. Now, I know health equity right now is a really touchy subject, but the situation remains the same. All we're asking for is quality health care for everyone, right? This requires training, system change, and a willingness to examine how care delivery excludes people. You may be wondering, where do I start? Maybe you're thinking, I want to do better, but I don't know where to start. You're not alone. This is exactly why we created the Empowering Providers to Improve Access to Care training through the IBD Patient Navigator program. This isn't another compliance module you click through. It's a 6-session team-based experience that helps healthcare professionals like yourself recognize barriers, build trust, and improve communication with underserved populations. Here's what's covered in the training. We will recognize and address systemic barriers in IBD care or healthcare. We'll build culturally responsive communication skills. We'll help you improve care coordination across disciplines. And we will create care plans that account for real-world patient challenges. This is designed for the reality of healthcare, for packed schedules, for limited resources, complex patients. It's practical, actionable, and built by people who understand what you're up against. Because real equity, real health equity, doesn't happen through policies alone. It happens through people, providers who are willing to do the hard work of building trust and closing the healthcare gaps. But here's my final thought. Your patients in underserved communities aren't harder to treat. They're navigating harder circumstances. And when you meet them where they are, when you see the barriers, validate their experiences, and build trust over time, it improves outcomes, not just clinically, but holistically. That's the work, and it matters. If your team is ready to strengthen patient trust and close care gaps, learn more about the Empowering Providers to Improve Access to Care training at the StephanieAWynn.org. And listen, one more thing I want to leave you with. We all are building relationships. No matter what ship you're on, maybe your partnership, friendship, leadership, companionship, whatever ship you're on, just know this. In order for that ship to sail, you gotta communicate with your patients. And when you communicate with patients, there is where transformation starts. Thank you for listening to the Navigating IBD with Stephanie Wynn. I am your host. If your healthcare team is ready to strengthen patient trust, improve communication, and close the healthcare gap, bring the Empowering Provider to Improve Access to Care training to your organization. Thank you for your time. And remember, together we can create lasting change. One patient, one strategy, and one breakthrough at a time. Until next time, peace. Thank you for listening to Navigating IBD with Stephanie Wynn. If your healthcare team is ready to strengthen patient trust, improve communication, and close the care gap, the Empowering Providers to Improve Access to Care training can help. This 6-session program equips teams with practical tools, enhance the patient experience through collaboration, empathy, and equity. Learn more or schedule a session at thestephanieawynfoundation.org. Until next time, together we can create lasting change. Peace.